The fetus is a fascinating patient. They have many accessible and developing stem cell populations that are gone once the baby's born. Historically, if you do fetal surgery where you operate on a fetus, the wound heals with no scar. So it's a very different patient than even a baby. And so the idea that you could get organs to grow more normally while they're in the process of becoming the organs that they're going to be is compelling. Our lab is looking at ways to treat and cure genetic and structural diseases before birth. The clinical practice in pediatric surgery is babies who are born with a variety of needs. So babies whose abdominal walls don't form normally, or diaphragms don't form normally, or lungs, guts, and airways that don't form normally. And some of these things are diagnosed before birth. And that's a window to allow the baby to develop normally if you can correct the problem. So our work is a collaboration with biomedical engineering and molecular therapy at Yale, and we deliver therapeutic agents in very small particles to try to treat genetic or structural diseases before birth. The first part of it is synthesizing those particles using a variety of techniques to verify that they're good quality and that they are loaded with the things that you think that they're loaded with. We're able to deliver those particles to fetuses in experimental models. And then there's one round of analysis, which is where are the particles going? So that's typically microscopy or flow cytometry. And then if you're trying to rescue a disease model, then the analysis depends on the model that you're looking. There are projects where we're looking at lung growth. Techniques to assess those are microscopy, functional assays, and we've actually started to get into more sophisticated molecular techniques like single-cell RNA sequencing and spatial omics, where you can really try to understand the interactions between the cells in normal fetal development and then the interactions of those cells when there's abnormal fetal development. With the spectrum of things that we're working in the lab, you could provide a single shot that would cure a variety of genetic diseases. So lysosomal storage diseases, diseases of the brain, cystic fibrosis, blood diseases. You may be able to have a single shot and cure a genetic disease for the duration of that patient's lifetime. Other strategies that are a little bit newer for our lab, 45% of neonatal death is due to these issues of prematurity. And if you could improve the health and function of the tissues that support a healthy pregnancy, then you may be able to drastically move the needle on these sort of major public health problems.